Hello, welcome to my podcast and my YouTube channel. Today I have the first Brazilian ever to be on my podcast,
What an honor.
Esly Carvalho. I'm finally talking to someone from my country. I've been searching for someone, but I really wanted this guest to be special, and I finally got it. So
Oh, thank you.
let me just give a little bit of information about you. She's a Brazilian American clinical psychologist. She specialized in trauma, and that's what we're going to focus on today. And she is an EMDR Institute Trainer of Trainers. We will talk about that later and explain what it is. With her team, she has trained more than 3,000 therapists in Brazil
3,000 therapists in Brazil. Yeah.
in the last
hmm
15 years, and she's the founder and clinical director of the Trauma Clinic in Brasilia. And for those who don't know, Brasilia is the capital of Brazil. I know a lot of people think it's real, but it's not.
But it's not.
Used to be, though, so they're not totally wrong. Used
Yeah.
to be until God knows when. So, Esly, thank you so much for being here with us,
My
for
pleasure.
sharing your knowledge with us. Let's start with the word trauma, because trauma, we have this general understanding that trauma is physical trauma. When we talk about it, people always think of sexual abuse, they think of physical violence. And that's not what it is only, is it? So, can you please explain to us what trauma is?
Well, I think there's many aspects to it. One is it's something unexpected that happened to us. Usually traumas are something that happen to us and catch us by surprise. I wasn't expecting the car to, slam into mine. I wasn't expecting the person to have that kind of an attitude. And it can be real, like as in a rape or an accident, and it can also be real as in perceived. I thought I was going to get killed, or I thought it could be dangerous. It wasn't as dangerous as I thought, but I perceived it as being it. So it can be real
Mhm.
or perceived. And many times we talk about these things that break into our reality, something that we really did not expect, that our mind cannot wrap itself around, that has happened to us, and that winds up taking up space in our neurons in a way that's very different than in a physical uh, arm breaking or something like that. And so we need to be able to understand how these things can affect us. And traumas are not just those big traumas that everybody agrees, oh, she was kidnapped. Oh, she was mugged. She was raped. She almost died in a car accident. She was in an earthquake. Everybody thinks, oh, wow, those are traumatic experiences. But one of the things that we have seen, especially with the ACE study, the Adverse Childhood Experiences study by Felitti and his colleagues, is that adverse experiences in our childhood will um, give us an idea of how many physical illnesses we will have in our adult life. There's a direct link. They did a study with 17,000 people. And so they asked 10 different categories of questions, like, did your parents ever separate, not even divorce, separate once between the ages of 0 and 18? No. Did you feel that you didn't have enough care, or that you were neglected, or that you didn't have enough to eat, or that you had to go to school with dirty clothing? People don't think of those things as necessarily being traumatic, but
Mhm.
these are the adverse experiences. And obviously, if somebody, commits suicide or has depression, alcoholism, drug abuse, all of those things, they also ask. And so all of a sudden we have a study that shows us that these experiences, even this, what we call, light traumas, little things, as
Mhm.
they build up, they can also inflict much of the damage that we also see with these one-time experiences that really, break into our reality.
Mhm.
So many people often think, well, I don't know if I can do this kind of treatment for trauma. I can't think of any traumas that I've ever had. But when you start asking the questions, surgeries are traumatic. The body does not like to be opened. It was something
No,
that I
and
saw in one of my
cut
books.
and yeah.
It just doesn't like this thing. We have to do it. We have to do it, but it doesn't like it. Treatment, how much, like cancer treatments and other, infertility treatments. How traumatic are some of these things? How difficult they are. Every month you're hoping that to get pregnant and you don't. the
Mm-hmm.
disappointments, and the treatments themselves can be very
Mm-hmm.
painful.
Mm-hmm.
So we see that there's a large range of definitions, of what we can consider as being traumatic, but something that really breaks into our reality unexpectedly and makes us think, wow, something very different is happening in my life that I did not
Mm-hmm.
expect.
Mm-hmm. Thank you. That was
Mhm.
very, very simple language, and sometimes it's hard to find that. But you mentioned surgery, and what came to mind was Van der Kolk's book, "The Body Keeps the Score."
Mhm.
And I
Mhm.
don't know if you remember, but he does mention a story, one of the cases that he saw of this woman who woke up during the surgery, and of course she felt the pain, but then they gave her some more anesthetic and she was okay again. But just by waking up and feeling and acknowledging where she was, the body interpreted as trauma. And for many, many years, she didn't know that that's what caused the trauma. She was having all kinds of physical, mental health issues, and they traced it back to that experience.
I have a friend who had an experience like that. Whenever she would go to a place where they had a bright light, if she sat under the bright light, she would immediately get a migraine. And it was so notorious in her family that even her kids would say, "Mommy, don't sit down there because you're going to get a headache." And she'd done all the exams and the tests and the medication, nothing worked. And one day she decided to do an EMDR therapy session because she had had a recent surgery where things had been kind of complicated. And I had talked to her about this. And sometimes the brain will go back and it will kind of fish out other memories that are connected in the same file. And
Mm-hmm.
15 years before, she had had a surgery where she had almost died. It was a life and death
Mm-hmm.
sort of thing, very difficult recovery. And all of a sudden, in the middle of this processing, she recovers the memory of having woken up in the middle of surgery. Now, she did not have physical pain, but she had this horrible, pain when she opened her eyes. And there
Mm-hmm.
were the bright lights of the surgery room.
Wow.
And the nausea of the anesthesia and the whole thing. She says, I can tell you where all of the doctors were. And I said something and they just kind of elbowed each other and the anesthesiologist put me under again. And of course, with the recovery was so, difficult. My life was kind of like touch and go for a while. Obviously, nobody was going to remind me that I had woken up. I totally forgot this memory. So we reprocessed this with a new therapy called EMDR, which stands for eye movement desensitization and reprocessing. She never had a migraine again. It's gone.
Wow. Wow.
So, how many of the physical symptoms that we deal with every day in our lives have to do with experiences that we are not aware of? They're out of our
Mm-hmm.
consciousness, out of our awareness, out of our memory many times, but they continue to have an impact. And that's why I think treating trauma is such a fundamental and important thing, because these are the things that make us physically sick, emotionally sick, our hearts, our
Mm-hmm.
emotional hearts, our physical hearts. Why do we have so much illness? How much of these experiences in our childhood are impacting our adult life? So
Mm-hmm.
it's a very interesting
Yeah.
case.
Yeah, and I'm glad you brought that up because that's my second question to you. Can you explain to us, I mean, why? You just said, why do we have all these physical illnesses? I mean, how does that happen? What is the impact of trauma on your brain, your body? I don't want to separate it because we know there's no
No, we
separation.
don't. Mhm.
Yeah, but how does it impact your body and your mental health?
That's very interesting. I had a patient many years ago when I first began seeing clients who was born with a congenital hole in her heart, we could
Mm-hmm.
say. And the doctors had told her, she came out of a lot of poverty. And the doctors had told her, you cannot have children until you've had this surgery, and you need to have this surgery to stay alive. It's a very, very serious situation. And she kept putting it off and putting it off and putting it off. And finally, she got married and she decided she really wanted to have kids. And so she came in and I prepared her to go to surgery. Now, back then, it was going to be open heart surgery, the really, traumatic kind where they saw you
Yes.
open and everything.
Mm-hmm.
And, they stop the heart, they sew it up, the blood goes on the outside of your body while you're having surgery. And then they
Mm-hmm.
sew up your heart and they put it back in, sew it back together. And they give you shocks to make the heart start beating again. So it's pretty serious
Wow,
stuff.
that's trauma right there, right?
Right there. So after the surgery, 3 or 4 months later, when she'd recovered some, she comes in and she says, "I'm going to die. I'm going to die. I'm going to die. I'm going to die." I says, "Como assim? What do you mean you're going to die?" Says, "What did the doctor say?" The doctor say, "I'm fine now." Says, "Well, what did they find?" Says, "They said that I could have dropped dead any minute. The hole was much bigger and much worse than they had ever imagined." Okay, so now you're safe. And she looked at me and said, like, safe? You know, I'm in danger. I'm going to die. I'm going to die. She says, "What do you mean you're going to die? The doctors say that you're okay." And I started putting this thing together. And this was before I was an EMDR therapist. But she was the one who gave me the first clue. It says, the body does not like to be opened. And it was like her body did not believe that she could die as long as it was functioning. And even with a big hole and all the effort of pumping
Because it was
blood through,
adapted to the big hole,
because it
right?
was adapted and it was the way it was all her life. But the minute she had to open this, and she got better, and she had children, and she got the whole
Mm-hmm.
thing. We keep up with each other. I've kept in contact with her, and the body says, "Oh, you know what? We could have died. We could die. We could die." And the body was traumatized, and so that's her fear. And this is something very interesting about trauma. It's like the past stays in our present.
There's an
And so
imprint.
the surgery
Yeah.
was gone. It was over. She was fine. She's lived happily ever after. But the body says, "I don't agree with that. I don't think this is a good idea. I don't like what's
Mm-hmm.
happening. Not really good. I'm in danger. I'm in danger." And that's where things really freeze up. So
Mm-hmm.
that was my first clue. Years later, a friend of mine went to see somebody who had a leg that had to be amputated. And
Mm.
one of the interesting things that EMDR will help with is phantom limb pain. And my friend
Yes.
calls me up and she says, "Oh, what do I do?" And says, "Well, go to the hospital and treat her." It says, "Well, I'm not real good at this. Anything you do that makes it better is better." So she went. 58 minutes later, the pain was gone because the patient realized, her body realized, that part of her body had been cut off. She
Removed.
got the
Yeah.
memo. The brain got the memo. It says, "You know
Mm-hmm.
what?" And so she said goodbye to her leg, to her foot. Says, "I really thought that we were going to finish life together, but it's not to be." They had to take it
Mm-hmm.
off.
Mm-hmm.
And she was on 4 medications for pain. The next day, they pulled it down to 2, and nobody could understand how her level of pain had gone down so drastically in an hour. She had no more
Mm.
pain because of that. The third day,
Wow.
they gave her half a pill, and that was that. And it's one of the few things that helps the brain understand what is happening with the body. It's a mechanism that is self-healing. It's intuitive. The brain just knows how to do it if we can just set up the situation where the brain can heal itself.
Mm-hmm.
It's just
Mm-hmm.
amazing. So
Well, let's
see, so
talk about EMDR then. You just mentioned a few of the things that you can do with EMDR. Can you just give us an overall view of what
okay.
EMDR
Yeah.
is?
My first training was in psychodrama and group therapy. And I was always very happy with this. So it took a lot to be able to convince me to kind of work in a different way. And I went into EMDR as, my first experience was as a patient. I don't think I would have gone in any other way. And I came out of my first session of EMDR so impressed with the results that I said, wow, I got to learn how to do this thing. And it's a kind of therapy. It's about 30, 35 years old now. It was discovered and developed as of 1987, 88, with Dr.
Mm-hmm.
Francine Shapiro, who passed away last year, unfortunately. And what we do is we kind of imitate what happens to the brain while we sleep. You know how we go through the cycle of
The
sleep and we
cycles,
repeat it
yes.
several
Mm-hmm.
times. And then when we dream, we have the rapid eye movement sleep, and our eyes move real fast back and forth. Well, when we're doing that while we sleep, we're processing the things that happen to us during the day. And in that crazy way that the brain has of putting things together in a very strange way, we dream. So we dream and we process and we put things away, and it goes into the old time memory, long-term memory, and blah, blah. But if something happens to us that our brain is not able to process, digest, metabolize what happened to us during that day, it's kind of like it gets stuck there, and it freezes that part of our brain, or our neurons, so to speak. And so something that should be processed and go into the long-term memory stays present and it stays present and stays present,
Mm-hmm.
consciously or unconsciously, as we saw in the other case. So what EMDR does is, I'm going to say the very simple way of doing it, we ask the patient to think about a difficult memory, an adverse experience, or traumatic or a bad memory, or difficult memory. The teacher called my attention in front of everybody and humiliated me, or, I have a lot of them in Brazil. I peed in my pants when I was 5, 6, 7 years old because the teacher wouldn't let
Mm-hmm.
me go to the bathroom. I have a lot of those when we go to do our practica. And we ask a person to think about it with a protocol so that we can find where it is kind of filed away in the brain. And we think about the image, the visual, and we think about we ask the patient to bring up what they think about themselves, because trauma does a lot of things to us. And one of the things it does is make us believe lies about ourselves. Okay. And so we ask them to bring up the negative cognition, we call it, but it's the lie that we believe about ourselves, our emotions, our physical sensations, and we can measure these things, with a SUD scale and another thing. We have specific scales for that. And then once we ask the person to think about it, then we can apply the visual bilateral movement. We ask them to follow, our eyes, our
Mm-hmm.
fingers with our eyes, or we can do this with light bars and other things, or it can be auditory, or it can be tactile. This gives the brain like a jump start. It's kind of like, it got stuck here. Well, let's kind of give it a push and see if it'll get past that point. And once it does, it will process things by itself. It's not like we have to go hunting for it, or I have to think of incredible words of wisdom to be able to, help the patient understand things. No, the brain does it, all by itself. And this is the amazing thing. And that's what makes EMDR not only so efficient, it makes it very fast. It has very fast results. And nowadays, 30 years later, we have it's recognized by the World Health Organization as being one of the 2 therapies efficient to treat trauma. And
Wow,
it's
good.
also recognized by the National Registry of Evidence-Based Psychotherapy and Practice in the United States, the in REP. So it's a highly scientific way of doing, though, even though it's a very strange way to do psychotherapy. It's kind of like, yeah, I'm gonna
Yeah, it does.
my
It's
first
not
experience.
intuitive, right? It's not
Yeah,
intuitive.
she says, "You're going to tell me that I'm going to think about something. I'm going to wiggle my eyes, and I'm going to get well." And she kind of looked at me and says, "Yeah." And I said, "You know what? That's the way, and that's the way it is. We kind
Yeah,
of,
yeah,
it's a lot more than that. But
yeah.
we move our eyes, and we imitate what happens to us in our sleep, and we do the job. We help the brain do the job that it should be doing naturally. It's
Hmm. So
amazing
you
stuff."
use the resources that our brain already has.
Yes. Yeah. Yeah.
That's
And some
cool.
people have, more resilience, and that's why they've been able to get through many of the things that they went through. You hear some stories of how this person ever survived.
I know, I
One
know.
person, really invested in their lives. Sometimes it was a teacher, sometimes it was a church member or somebody from a temple or synagogue or something. Sometimes it was, a grandmother, a grandfather who lived far away, but
Hmm.
who would write and, send them things. And sometimes just one person makes that difference, and how they were able to, respond in a better way. And then other people really have more resources and are able to, develop these things and be able to, treat some, and we work with some of the most horrific things, the horrific memories that people have. And one of the nice things about the treatment is that you don't really have to talk about it. And this is a paradigm shift
In
in
therapy, yeah,
psychotherapy.
for sure. Yeah.
Yeah, yeah, yeah. You do psychoanalysis and stuff. Breuer and Freud all talked about the talking cure and how, we need to
Hmm.
talk and it'll get things better, and how we can interpret things and things. But this is done in silence. So much of EMDR treatment is done in silence. And it has the advantage of not having to talk about the details. Sometimes the graphic details, like
Yeah.
sexual abuse or certain kinds of humiliation or torture or war, rape.
Hmm.
People are either very embarrassed to talk about it. Sometimes they can't really put it into words in the beginning because they don't have the words. The words are on one side of the brain, and the pictures and the memory are another part of the brain, and the two aren't talking. And so they really don't know how to put this together in the beginning. After we've processed it, sometimes they'll say, "You know what, now I can tell you what happened. It was like this, it was like that," and we get a narrative. But it's a kind of therapy that does not need to have a whole lot of, verbal speech to be able to do it. And sometimes we even treat people without ever knowing all of the details of, what
Mhm.
they really need to do, what happened to them
Yeah,
and stuff.
yes, and you're saying that, and I'm just thinking here. Not only that, but we know that what we used to do in the past. I don't know if it was 60s or the famous exposure therapy, right, for
Yes.
trauma. We know now that it can re-traumatize the patient.
Hmm.
So
And,
that's a good thing that they don't
and it's
have
one
to
of the things
actually.
that, yeah, it's one of the things that they talk about too, because some aspects of exposure therapy, especially with CBT, cognitive behavioral therapy, and some of it is profitable, but people will not do the homework. They can't stand to keep thinking about it and thinking about it, 5, 6 times a day in order to desensitize it. Whereas with EMDR, many times with one session, 2 sessions, 3 sessions about that particular thing, and it is done. And so much of this starts in my office, but it finishes, in the next few days while my patients sleep, because they all sleep between one session and another. And so many
Hmm.
times we weren't able to do it all in one session, and they go home and they sleep. And when they come back, it was like between a 0 and a 10. When I left here, it was like a 4. But now it doesn't bother me at all. I had I had a medical doctor whose home was burglarized for hours, and there were 6 people in the home. They threatened to kill him, threatened to take his daughter. It was just one of those, bad stories. And he had such a bad case of PTSD that he had been on medical leave for a year.
Wow.
And when he came in, we did a double session, 2 hour session, because I was kind of, with this pretty big thing. I don't want to stop in the middle. We started obviously on a scale of 0 to 10. It was a 10. It was just so horrific. And when we finished, it was a 4.
Hmm.
And he came back, a week later, and we took it up and says, wow, now it's a 2. And we finished it off, came down to 0, you know. And a few weeks later, I asked him, so, do you remember that thing about, your home getting broken into and blah, blah? He says, yeah, how much does it bother you now? He says, ay, doctora, that's a story for us to tell people in happy hour on Fridays. And I looked at it and says, your job was in jeopardy because of this memory.
Yeah,
It's,
yeah.
it's just something to tell people of, happy hour and stuff like that.
So yeah, good, good. That's a great, great story. I want to still keep talking about what trauma is because I do think that there's so much misconception
There
and
is.
misunderstanding about trauma. Let's talk about collective trauma. That's what we are
Oh,
going through right now.
yes.
When we talk about
Yes.
collective trauma, COVID is it, right?
This is it.
It's
Yeah.
bringing much, I'm sure you see this too in your patients, a lot of anxiety, all the uncertainties, all the changes of information. Today, one thing is good, next day it isn't. All the isolation.
Wear
I
your
mean,
mask, don't wear your mask, wear your mask, don't wear
wear
your
your
mask.
mask, all the stress that you go through, people losing jobs. I mean, I can go on and on and on. But September 11 was another collective trauma. And that, so let's talk about that a little bit.
I think there are a lot of things that are very worrisome about this situation. First of all, because it's global, it's affecting the whole world. I mean, we have never lived in our lifetimes, and I can't think of other situations where the whole world was affected by something like this, and the whole world stopped. Look at how many things have come to a grinding halt because of an invisible enemy. Because many times when we talk about wars, we had World War II. Well, everybody knew what was going on, who the enemy was, who the enemy wasn't, and who was on, whose side are you on, and do we shoot and do we not shoot, and the refugee camps and the Holocaust. But now we're facing something we can't see. We have an enemy. We don't know, if it came in this way, or if somebody sneezed, or if, and you're beginning to look at people with distrust. Yesterday I saw somebody on TV says, I go up the elevator and people are looking at me like, oh my goodness, I even walked into an elevator in a medical building in Brazil. I've been in sheltering in place for 5 months in Brazil. I'm just now in Canada and in quarantine,
Uh-huh.
but coming out of it now. And I was in an elevator, and a lady came in, and she says, do you mind if I go up the elevator with you? And I thought,
Wow.
this has never happened to me before.
Yeah.
I
Yeah.
was even, looking on my Facebook, and I asked, what did you say in the last 6 months that a year ago would have been incomprehensible. This was one of them. Says, "May I go up the elevator with you?" And this is a woman asking another woman. Says, "Is it okay?" Because of the risk of contamination. And we all had our masks on and everything. So we're talking about loss. We're talking about loss in a big scale. We're talking about mental health professionals. We're talking not just people in the front line who are like the doctors and the nurses and the physiotherapists and the nutritionists who are in the hospital. I was in the hospital with my husband at the very beginning of the pandemic, as it began to get organized in the lockdown. And I've worked in a hospital, and I looked around and says, I know what's going on. They're getting ready for the big thing. The big one is coming.
You
The big
could
one is
tell,
coming.
yeah.
Because they were transforming the regular rooms into intensive care rooms. And all of a sudden, my floor, the cardiac floor, my husband had a heart problem. And so we were on the cardiac floor, and I could see, this is not good. I walked in and everybody stopped talking. I thought, they're talking about, the measures they need to take
Yeah,
to be able to
they need
protect
to take,
themselves.
yeah, getting
But we're
ready
also
for the worst. Yeah.
we're also talking about trauma at another level, the people who clean the hospitals, the janitors, the people who deal with the trash. In Brazil and Latin America, many of our countries, as you well know, we bury people within 24 hours. So we're talking about the grave diggers, and we're talking digging graves 100 a day, 200 a day.
Wow.
And I remember we had a really bad nightclub fire about 7 years ago in a southern city called Santa Maria, where
Yeah.
243 young people, most of them died almost immediately. And it reached a point where the grave diggers were asking for help. The taxi drivers, it was a small town, says,
Wow.
we can't deal with this level of death anymore. And so we have some of these places, and we're doing this kind of like in waves, right? We had the first wave and the second wave. Well, now it's okay. We're going to go back to normal. People go back to normal, the old normal, and they produce the next wave of it.
Yeah.
So we talk about transition. When this is over, well, for Brazil, they're talking 2 years for it to be over, even if we have a vaccination. So am I going to stay home
Yes.
for 2 years? Because I'm a
Mm-hmm.
risk group. What does
Mm-hmm.
this mean as far as, my work? Well, I'm one of the lucky people. I can work online. I can see my clients online. But what about, the massage therapists who have to do this with their hands,
Mm-hmm.
other people, who build, the, bricklayers. How many of us are paying, our maids, our governesses and everything like this without having them come to work? You stay home,
Yeah.
I'll pay you to stay home. Because we don't want, because it's a social crisis. We're not going to have people who are pulling themselves out of poverty, but many of them have lost their jobs and they're having trouble eating again. I've seen something that I had not seen anymore. People knocking on my door, asking for food, asking for water,
Really?
asking for
In
clothing
Brazil?
in Brazil. This had
Wow.
stopped.
Yeah.
This had basically
Yesterday I
stopped.
was yesterday I was talking to this woman who is a great friend of mine, and we keep in touch, and she used to be my cleaner, and she was telling me, because I always worry about her, because I know she needed to clean houses, to eat. And she was telling me I have to go back because I have one or two people who are still paying me, but most of them stopped, and I need to go. So
Yeah.
there isn't
And so
really an option for many people.
if you can die if you work, and you can die if you don't.
Yeah.
And it's
Esli, let's
literally,
let's talk about, again, talking about trauma. And when we think about COVID, there are two things that I want to talk, that I want to hear your view on it. One is that we know as therapists that the number one healing thing is relationships. We know that. You mentioned in the beginning, right? People that you talk to, and sometimes it's just one person. So relationships are healing. We are collective people. We need connection. Our brains are wired to connect. And COVID took that away. Not only took that away, but now connecting is danger, right? And that's
yes,
the second part I want to hear you about. And that's what the brain does when you have a trauma. It interprets things that are not dangerous as danger, and it stays there. That's why you sometimes are hyper vigilant and you're always expecting the worst. You startle easily, things like that. So I often think about the relationships. As you said, you go into an elevator and people back out, right? They go, you are dangerous to them now. And it's not just strangers, it's
No,
family members,
it's
people you
family.
love. I see now my niece, whom I absolutely adore like a daughter. I spent almost 3 months without seeing her, and now we see each other with masks, and I haven't been able to kiss her. And it hurts. We say to each other all the time, I can't believe we can't hug anymore. And you know how Brazilians are. We hug. We
Well,
love hugging. We touch. We're very touchy people.
yeah.
So yeah, I want to hear your view on that, because
I think
it's
I
the
think
one
this has
thing
been a
that
big,
worries me the
yeah.
most.
It worries us all. Like you say, in Latin America and Brazil, we're all very huggy people, and I can't remember the last time I hugged anybody besides my husband. Because it's just been him. And I might even see my friends far away, with our masks and things like that, but we can't touch. So one of these things is happening is it's sowing distrust. It sows distrust, which we used to be able to trust people, and now we can't. Now, if we walk in Brazil, you have to walk around with a mask. If you don't, you can be fined, and they're big fines, like $400 or $500.
Mm-hmm.
And so we've lost the ability to be able to see the bottom part of our faces. We've gained being able to see in our eyes again. But this is the part of the face that tells us, is this person smiling? Is she being ironic? Is she angry? So we can't read faces the way we've been taught to do all of our lives from birth. So we've lost that. And I don't know how we're going to regain some of this, because I think this is going to be 2 or 3 years.
It's going to take a
People my
while.
age,
Yeah.
yeah, people my age, no big deal. I mean, 2 or 3 years is nothing. But if you have a 3-year-old, and all they see are people with masks on, what does this mean? So I think we have some of those things. And I think there's several things about trauma that trauma does to us that we don't always realize. I think you said very well about being hypervigilant, and the danger is all around, and we interpret things through the lens of our past traumas. Trauma also keeps us from learning. We oftentimes get kids in school who seem to be doing poorly. Says, no, I was just dumb. I just was stupid. I couldn't learn to do things in school. I just wasn't very smart. And then you start asking, what was going on in school? Says, well, that was the year, the year I failed was the year my parents divorced. It was the year that they really fought, a lot in the judges and the courts, and, the custody rights. And my father did this, and my mother did that, and blah, blah. And then I think, how can you learn math if your brain, if the inner noise, what you're trying to digest about what's happening at home, the inner noise is so high? How are you going to learn math? How are you going to learn how to conjugate a verb? It just doesn't go in. So trauma keeps us from learning. And this is a big deal in a society that all of a sudden has totally changed its way of teaching, because we were teaching with people, and now we're teaching with people through a machine. You know, we were looking at the Jetsons the other day, and I thought, wow, I remember when I was in Saturday mornings, we'd watch the Jetsons, and now
I
we're
used to
doing
love
this.
it. I used to love it. And now we're it.
Now we're it. Now we're doing this. But we're teaching
Except,
children.
Esli, except remember that they had
Oh
it was a
yes,
glass
the
thing that
bubbles.
would
Yes.
go down, and then when it went up, the woman was, I mean, the hair was done, you had makeup on, the dress. We still don't have that, unfortunately, but we'll get there.
So now all of a sudden we're teaching children from one day to the next, from 1 week to the next, from 1 month to the next. We're teaching in a completely different fashion, in things that we really weren't prepared either to teach or to learn that way. I'm not even going to go into, is this good or is this bad? All I'm saying is this is very different. This is very different, and it's all of a sudden, and some people do well with it, some people do not, because some people really need the relationship in order to learn. So I think that's one of the big deals. Trauma also takes away from us our ability to choose. I want to be able to do differently. When people say that to me, or when somebody bullies me, or when they say blah, blah, blah to me, I want to be able to respond in a different way, and I cannot. And I know what I should say, I know how I should say it, I've practiced, but I still can't get it out. That's trauma. When we see behavior that doesn't change, that's locked in, that's frozen in place, my brain knows better, but my body won't respond. Trauma.
Let's
It's
dig
trauma.
in. Yeah, let's
It
dig
is.
in to see
It's
what's
there.
there.
So we can go, find out, where did you learn to do this? How did you learn to do this? What were the experiences? Who were the people that you learned this from? Because we learned this in childhood, from our parents, from our school teachers, from the bullies, and we learn how to respond in a way that will help us survive. So we have all of these, survival strategies that help us survive. But when you're in a swimming pool and you're thrown
Doesn't it
in and you
doesn't
got
mean
to
it's
survive, you
healthy,
swim
right?
however you can.
Yeah,
But if
yeah.
you want to do better, then once you're out of danger, what do? You go to the school, and the teacher teaches you how to do the
Hmm.
crawl, and how to, the breathing and the steps and the hands and the feet and coordinate. So people who are traumatized are just flailing in the swimming pool trying to survive all the time. So look at how much energy this takes, how much concentration and focus it takes just to survive, when there really isn't that much physical danger anymore, but the perceived danger continues.
Yeah, and no wonder the body gets sick,
The
right?
body gets sick
Because you
because
have
the
stress.
hormones.
Yeah, the level of the hormones, cortisol, everything is just up the roof all the time, and
Yeah,
it takes a toll on your physical body as well.
it does.
Ashley, we're running out of time, and I
Okay.
do the one thing that I always try to do with my podcast, and that's my main objective, is to give my audience hope. So I hope they understand better what trauma is and how it expresses itself in their bodies, their minds, and in relationships, in the way that they perceive the world. But I want to give them hope too. So if they do now, by listening to you, they go, wow, maybe I do need to look into this. What can they do? I mean, how can we help them?
I think we now have trauma specialists. We have people who understand trauma, and that now there are solutions for this. We don't need to live like this for forever and ever. We can get better. We have healing for trauma, for PTSD. So many of our other more serious and severe diagnoses are often misdiagnosed. They really are PTSD disguised as other things. But when you go digging, you find the trauma. If you heal the trauma, the rest of the stuff really gets better. So I would really encourage people to seek out help. There's EMDR, there's brain spotting, there's CBT, there's lots of different therapies nowadays that can really help people understand trauma. Obviously, I'm partial to EMDR because this is what I do and this is what I teach, and but there is hope. We don't have to live locked into these old memories of our brains. We can change this. We can do differently. There are solutions for it. So please, please, please go online, look around, study it.
Hmm.
Put it in the Google, put
Yeah.
people's names in the Google. Find out, who is a trauma therapist, who is a trauma
Hmm.
recovery specialist close to you. And so many people are doing everything online. So now you can choose somebody in India if you want to do therapy
I know
nowadays, as
with
long
telehealth
with
has really
telehealth we can.
broadened. Yeah, because
Yeah.
in it's a big thing too. Because as you said, not many therapists are specialized in trauma. Not many know how to deal with trauma, and sometimes you live in the rural area or a small city, and you just can't find them. And they didn't have any
and
choice, and now they do.
yeah, and one of the things I do is I have intensives, and there are other therapists like me who do this of 2 and 3 days. And so I get one client, and we work on all of their childhood traumas, as many as we can, in 1 or 2 days, 3 days. And so we
Hmm.
get a whole lot of stuff out of the way, and then the brain keeps working, while they sleep. So there's a lot of things that can be done nowadays. There's no good reason for people to live stuck in these old ruts and ways of doing things. There is hope. They really should look for it. I've written some books. I have some books on, I call it about Heal Your Brain, Heal Your Body. That's the one that
Hmm.
has the story about my friend who had who recovered the memory of the surgery.
Of the lights, yeah. Hmm.
Yeah,
Yeah,
but
I'll make
there's
sure I have all those links on my notes so that they
okay.
can find you, your website, and everything. Thank you, Ashley, so
Thank
much.
you.
It's good to have another Brazilian to talk
That's
to.
very
Let's
nice.
let's
Somebody
give
who
a
understands
Brazilian
me.
hug.
Oh. We do.
A virtual Brazilian hug.
Virtual,
I hope
yes.
we get to see each other in person very soon.
I hope so too.
Yeah, maybe I'll come
Thank
to
you so
Canada. I
much.
love Canada, but it has to be summer. There's no
Yeah,
way.
Canada. I married a Canadian, so
Oh my god, I love Canada, but I cannot deal with their It's too much snow. Too cold for
No,
me.
it's too cold. It's too cold, too long.
My warm Latin blood does not agree with it.
Neither does mine.
Yeah, thank you, Esly. You keep
Thank
safe.
you
You're going to
so
stay
much.
there in Canada?
I'm going to stay here for a few months, January, February probably, and I may wind up spending part of the year here and part of the year in Brazil. You know, the winters I go to Brazil because I can't deal with the winters either. I'm a
No.
cancer survivor. I had thyroid cancer 6 years ago. My thermostat can't stay warm, and
Oh,
so I'm not
well,
staying
that's
for the
harder
winter.
for you. Yeah.
Yeah, and then
Okay, good. Good
yeah,
for
and then I'll
you.
come back.
That sounds to me like the best of both worlds.
Yes, I think so.
Stay there for the summer, and then you go to Brazil. It's summer again.
Yeah, summer again.
You're going to be on one just summer all year long from now on. Good for you. All
That's
right,
good.
Esly, thank you.
Thank
Have
you
a
so
good
much.
day.
Appreciate it.